Welcome to Marian Ayurveda. In this first episode, we will be discussing epilepsy in children, the preventive measures, and the various types of treatments available. I am Dr. Anumod Kakkassery from Marian Ayurveda, Thrissur. One of the conditions that pains me the most is this epilepsy that occurs in children, or the type of epilepsy that occurs along with fever, which in modern medicine we refer to as febrile seizures. Why does this fever occur, or why does this type of epilepsy happen? There are two things about this that really trouble me, which I consider to be a bigger disaster than children having epilepsy along with fever. One is that in order to prevent this disease, these children are made to take medication continuously for 4 or 5 years, which can significantly reduce their intelligence, or sometimes they become extremely hyperactive or aggressive. So, what happens to a child as a result of taking medication continuously is an even greater disaster than having epilepsy itself. The second issue is that the anxiety parents feel about whether their child will have another seizure gets transferred to the child. The child also becomes extremely anxious and turns into a fearful child. This is something that destroys their confidence for their entire life. So, more than having a seizure with a fever, the greatest danger is the fear about this disease, which can ruin a person's life. That is the most dangerous thing, more than taking medication. I know, this is something that is widely spread. Until the child experiences a seizure, they may have been very smart and studious, but after starting these medications, they get expelled from school, or they become extremely hyperactive, very aggressive. Your parents feel like they can't manage them. The child's entire career gets completely ruined because of this. This is how we think about this one episode. Is it possible for us to eliminate it? In what all ways can we do this? I have treated many people in Ayurveda, and we have been able to completely save many who have had epilepsy. So what we look at is, in what all ways can we treat this, or how can we prevent the recurring fevers that children get? Up to a certain extent, these fevers are associated with this. These kinds of febrile seizures occur. So when we think about this, first we need to consider how fever presents in children and what are the specific characteristics of the fever that leads to these febrile seizures. What is special about this type of fever? As we all know, it is usually associated with a high temperature. The development of fever, that sudden onset of high fever, usually happens in the initial phase. Most of the time, febrile seizures, that is the seizure-like episodes that occur in children along with fever, are explained by modern science as resulting from the child's brain being unable to withstand such a dangerously high temperature. That leads to an electrical discharge there, resulting in a seizure. Once the child grows past a certain stage and the brain matures, it becomes capable of withstanding such a fever. That's why it's important to be especially careful until about 5 or 6 years of age. I am thinking about why children tend to get this kind of fever as well. From my experience with many children, those who regularly get fevers or have had febrile seizures, what I have noticed is that these children tend to have a much higher prevalence of worms. The things I am saying here do not have a lot of research backing them. This is just my hypothesis. By hypothesis, I mean it is just an assumption based on seeing many patients. One thing I have observed and understood is that based on the high temperatures children experience during fever, I feel that the underlying cause in many cases is worm infestation. The reason I say this is because of a logic I have arrived at. A single worm, which we often consider insignificant, can lay up to about 15,000 eggs on average. It is said that the range is from 10,000 to 17,000. When a single worm lays eggs, within a week, those eggs can grow into 10,000 or 15,000 worms. Each of these worms in turn lays another 10,000 eggs. This cycle continues and the number of worms keeps increasing. If this kind of worm multiplication continues, it will disrupt all the metabolic activities in the body. In such cases, the body uses a technique where it creates a high temperature, resulting in a fever. When such a severe and powerful fever occurs, all these worms are quickly destroyed. I believe that the body has this mechanism as a natural way to kill them. However, when such a high temperature fever occurs, sometimes the brain cannot tolerate it, and this can lead to seizures. This is the reason I have identified behind it. When I thought about what supports this, I realized that for children who regularly get fevers, especially in February now, if we give them the Ayurvedic medicines we prepare once a week for a few weeks, we can eliminate the occurrence of fever in these children. That means when we give medicine to kill the worms, children naturally develop immunity. We have observed that these children do not get fever in February anymore. Or in the case of children who used to get fever once a month until then, they have now reached a state where they no longer get fever at all. So the way I manage febrile seizures up to a certain extent is by giving medicines that kill worms. Another thing is that when there is an increase in worms, one issue that occurs is what we call agnimandia or indigestion. In children who develop indigestion, I have often seen such seizures occur after eating biryani or after eating paratha, but not in newborns or in children under the age of 5 or 6. In older children, many times what I have felt is that this indigestion is the cause. Often this indigestion has been the reason for seizures in these children. So worms themselves can sometimes be a cause of fever. Along with that, children can also be affected. Worms can also cause indigestion. Similarly, if children eat heavy foods or foods that are difficult for them to digest in excess, that too can to some extent eventually become a cause. And at this point, I remember a mother who brought her 16-month-old baby girl. That's the case. That month, they were in the hospital for almost half the days on a regular basis because the child was admitted with seizures. So I thought it should never be possible for a 6-month-old baby like this to have such a condition. The baby is only being breastfed. Where exactly is the problem happening? Since the baby is only drinking breast milk, I thought maybe there is something wrong with the mother's milk, so I decided to examine it. Ayurveda describes many techniques to determine whether a mother's breast milk is good or spoiled. There are methods described. We have 11 tests for this. And after I performed those tests, what I realized is that one of the tests is to pour the milk into water and observe. Normally, breast milk, as shown in one of our videos, will dissolve in water and disappear like clouds. But in the case of this mother, when I checked, the breast milk settled at the bottom in layers, almost as if some kind of sediment had been mixed in. So it just settles like that. That's why for this 6-month-old baby, the breast milk is not digestible. The baby is unable to digest it. The after effect of this is that when children have poor digestion, it can lead to seizures. From my experience over the years, I have realized that poor digestion can lead to epilepsy. So I discovered that the reason for this baby's seizures was that the mother's breast milk was indigestible for the baby. In the end, when we reduced the thickness of the mother's breast milk and regulated the mother's eating habits, the milk became lighter and easier for the baby to digest. Along with that, the seizures that the baby was experiencing disappeared as well. Another type of epilepsy I have seen in children is caused by the merging of blood vessels in the brain. That is, the arteries carrying pure blood and the veins carrying impure blood come together, what we call arteriovenous malformation in English and modern medicine. This particular child is about 18 years old. Throughout this age, several surgeries have been performed to separate these blood vessels. It is in such a situation with these vessels merging that this child finds themselves. The child experiences frequent epileptic seizures, sometimes several times a month. Then we administered Ayurvedic medicine to this child, following our body theory and aiming to prevent such episodes. There was a significant difference, but it was not related to the previously mentioned concepts or anything from there. None of those concepts applied there. The child's body was extremely hot due to the intensity within. So when we gave medicines that cooled the body and the head, and helped bring down the body temperature, the parents reported that the child did not have any more seizures after that. The child continued taking the medicines for quite some time, and then after that they were gradually withdrawn. So in that way, I have personally handled about 11 such cases. But anyway, I feel that if anyone is facing such difficulties, Ayurveda definitely has a good solution for it. Of course, there can be differences depending on each individual case, and we need to understand that. But still, up to a certain extent, we can consider whether Ayurveda can help in such situations, whether it is possible to cure these blood clots with medicine. This issue arises due to certain problems in the body. When we address and resolve those underlying issues, there is a possibility for the body to return to its normal state. The treatments we have used are all aimed at that. By correcting the metabolic functions or other bodily activities and by making adjustments to the diet, we have been able to help patients overcome this problem and lead a normal life. So what we discussed in this episode is that this condition, which occurs in children, is not something that parents need to be overly worried about. I have never felt that this is an issue parents should fear. What I am saying is, if we regulate the child's digestion and consistently administer the necessary medications, we can manage this condition to a great extent. Up to now, I have never felt that this is a situation that warrants excessive worry. With this information shared with all of you, I am concluding this video. We will meet again in another episode. Thank you.